A lot of attention and honestly, a very deep dive. It's a new study. It's out of Oxford's Journal of Sexual Medicine, and it shows transgender people are more depressed and suicidal after undergoing sex change operations. In fact, men who underwent these surgeries are 2 times more depressed than those who did not transition. It's not much different for women. Nearly a quarter of those who transitioned are now depressed. Now, my next guest knows a lot about this. Dr. Eifenheim is a Dallas-based surgeon who was charged with leaking the records of underage patients' gender transition-related care. The case was later dropped days after President Trump took office, and he joins me now, Dr. Eifenheim, by the way, who was also at last night's dress. He was at the joint session of Congress along with Missouri Senator Josh Hawley. Doctor, thanks for being with us. Let's talk for a minute about this Oxford study. First of all, are you surprised by this? You see everything. By the way, it's not just depression, right? It's suicidal thoughts. It's anxiety. We could put the stats up. I mean, anxiety spikes, right? The minute you transition, it goes from 2% to almost 13%. All of the different things it's supposed to alleviate, doctor, it actually makes worse.
And, I think we have to ask ourselves, is this really any surprise? If you were to convince someone that they're the opposite sex and the rest of their lives they have to rely on medications and surgery, would they not be miserable every single day having to live that lie and to commit themselves fully to it, never being able to be free from the hospital medical complex? And that's why I find these studies so interesting, because as a doctor, as a scientist, you have to ask yourself, can we answer this question with reason alone, right? In medicine, the most important treatments we have are not guided by randomized controlled trials or statistics. It's simply rational thought and logical thinking. If you have someone who's bleeding, right, you stop the bleeding. If you have someone who has an infection, you drain the infection, you treat it. If you have someone who has mental anguish, who believes they are the opposite sex, the answer is not chemotherapy, drugs, hormones, and surgery. The answer is to listen to that person, to understand where that pain comes from, to be there for the person and make sure they know that they're perfect just the way they are. It's not, we don't have to complicate it too much, when I think we all understand that we can answer this question without complicated studies. But yeah, of course, the study's going to show that. Yeah.
Well, but why this study is important is it is giving you reason, logic, and data that backs up what you intuitively knew in common sense. And I want to hammer this because I think it's important. There's 100,000 people in this study. It's not like some small sample size. This is a lot of people in this study done by Oxford. And doctor, even the name gender affirming care, the way this entire thing has been characterized, the argument that is made to validate it is we are saving people from potential suicide. If we don't do this, people will kill themselves. They say that specifically about children, or they'll have severe mental health issues like depression. And again, this is saying the opposite. If you do this, if you medically transition them, you will make depression and potential for suicide worse. That should be an open and shut case. Book closed. Over. No more doctors endorsing this.
And especially when you consider the name gender affirming care, it's just this Orwellian euphemism that's meant to invert the reality of the situation, because what you're doing is affirming the exact opposite of what they are, right? And you bring up a really good point about the numbers of the patients in this study, because the ones that had been used previously by these doctors to justify doing this to children, right? These are typically small numbers of patients, right? If you manipulate things in a certain way, you can come up with whatever result you want. But once you start getting to a higher number of patients, right, a wider sample size, then yeah, you are going to have the reality of the study line up with what you see in the real world. And yeah, I mean, the name was designed from the beginning to deceive people about what it really is. It's kind of this bubbly sounding, sympathetic. It's very you hear it and it just sounds good, right? But it's couldn't be more opposite of the truth, because what it really is mutilation and sterilization, and that's not hyperbolic, right? Those words are the most scientifically accurate ways to describe what's happening. Mutilation, which is the infliction of a disfiguring injury onto an individual. And then the sterilization is the removal of their fertility. And the disfiguring injury not only applies to the surgeries, but also the medications, the hormones, and the blockers, because those will disfigure you from the inside out, right? Because there's no surgery in the world that can change your hormonal state, right? Like every single, square inch of your blood vessels, right? The hormones that go through there, those medications will change all of that. Your brain chemistry, your bones, your sexual development, everything.
Really quickly, we're down to about a minute, doctor. But so the Hippocratic Oath is that you do no harm. That's first. So we're talking about doing harm here. That's what we're talking about. And you put in the terms of mutilization and sterilization. How do you save your profession? Your entire profession seems to endorse this as a legitimate medical treatment that clearly violates the Hippocratic Oath in that it does harm. By the way, probably to be in vogue, to be in fashion, to be socially acceptable. There's clearly no medical backing for what's going on in your profession. How do you save it?
It's interesting you say that, because maybe 5 minutes ago, right before this, I was seeing my patients in clinic, and one of them was just saying, we have lost complete trust in doctors, right? They trust me because I've seen them before, but what we have to do is we have to tell the truth, and we have to do so courageously. We cannot be equivocal, right? We can't be halfway to the truth.